Hi, I'm Megan Charleston.
And I'm Katrina D., and we did our second clinical rotation at St. Vincent's Medical Center in the Cardiac Rehabilitation Department with exercise physiologist Kenneth Kursky.
Unfortunately, this rotation was much more hands-off when it came to performing practical skills ourselves. However, one of the things that we were able to work on were our interpersonal skills and how we interacted with the patients at the cardiac rehab program.
So while we were there, we just got asked some questions about them and got to know them and asked them what brought them to the cardiac rehab, how they were liking the cardiac rehab, what machines that they like to use, how their day was going, as well as how along the program they were. So we had a couple people who had just started, a couple people who were halfway through, and a couple people who were just finishing, so we got to see the perspectives of each person along the way.
And even though we weren't able to perform too many practical skills ourselves, we were able to observe the nurses performing practical skills, like taking blood pressures, monitoring the patient's blood glucose levels, and monitoring their EKGs while they exercise. We were lucky enough to actually have our clinical instructor, Kenneth Kursky, as a professor last semester. We both took his clinical EX class as an elective, and actually a lot of what we learned in the classroom overlapped with what we learned at this rotation.
So one of the topics that we discussed in class was diabetes and how it's often paired with heart disease. We learned about the importance of monitoring blood sugar levels before, after, and sometimes during exercise, because we learned that exercise does have a huge influence on blood sugar levels. Of the 12 individuals that usually attended the stage 2 cardiac rehab, we observed that half of them, so 6, had type 2 diabetes. In class, type 2 diabetes was defined as insulin resistance in which glucose does not readily enter the insulin-sensitive tissues. The pancreas releases much more insulin due to a hyperglycemic state and creates a cycle that promotes resistance to that.
All the individuals at cardiac rehab who had diabetes tested their blood sugar level at the beginning and end of each workout. And for the most part, there weren't any issues. But the last time that we went to observe, 3 of the individuals actually reported lightheadedness before and during exercise. One of the individuals' blood glucose level actually dropped to 60 milligrams per deciliter, and what we learned in class was that if your blood glucose level drops below 100 milligrams per deciliter, that could warrant a stop in exercise and the need for a snack.
So since her blood glucose level was so low, we noticed that her hand started to shake, and the nurses gave her a small serving of soda, which usually helps to digest the food a little bit faster, and along with that, they gave her graham crackers and peanut butter. Another individual started to sweat a lot more than usual and stopped exercising. So she came prepared because she knew that this was going to happen, so she brought an apple and some peanut butter as a snack. We were able to see how a simple snack that so many people wouldn't think twice about had such a serious impact on a diabetic individual's blood sugar level within a couple minutes. So as we said before, Megan and I both took Kenneth Kursky for clinical exercise science. While we were in his class, we learned about the different stages of cardiac rehab. We got to see those stages put into action while we were at St. Vincent's Medical Center and noticed that the big difference between stage 2 and stage 3 was monitoring. For stage 2, the individuals were linked up to an EKG, and it was just interesting to see how the electrodes were hooked onto the individual for us to see their data on the monitor.
We also got to see nurses take individuals' blood pressures, and we also got to see them monitor the blood sugar levels of the diabetic individuals before and after exercise. We also got to see the educational component of stage 2 of cardiac rehab, and in one of the sessions there was a lesson on stent procedures, and another one of the sessions had a lesson on guided meditation and how it's used as a technique to reduce stress.
We were also able to see what types of machines provide appropriate exercise for the different populations of stage 2 and stage 3 of cardiac rehab. One of the patients also showed us her insulin pump and blood sugar sensor. It was just really interesting to see how the technology helped with her condition to stay within the therapeutic range. So there's like a range of too low and too high, and the insulin pump tried its best to keep between the therapeutic range. So when it did get a little bit low, it would send her a notification or kind of give her a buzz to stop exercise and have her snack.
In an article by John C. Pickup and Eric Renard, they discuss the effectiveness of insulin pump therapy. It has been considered in recent years as a potential routine means of improving blood glucose control in type 2 diabetic patients who remain difficult to control because it provides a more physiological plasma insulin profile. Overall, we both really enjoyed this rotation, even though it wasn't something that was on our original list of preferred rotations to do. It was actually really cool to see what we learned in class last semester applied in a practical setting.
And it was just really cool because it sparked our interest, so you never know, maybe we'll decide to choose a field in there.